Hello, I'm Badrul Hussain, and I'm an eye surgeon. If you have cataracts, stronger glasses and brighter reading lights may help for a while, but cataracts do get worse over time, so you will eventually need surgery. Cataract surgery takes 20 to 45 minutes and involves replacing the cloudy natural lens in your eye with an artificial lens. Before surgery, you'll be referred to a specialist team for an assessment. The assessment is an opportunity for you to discuss anything to do with your surgery, the risks and the benefits, and what to expect on the day of surgery, as well as the recovery time. During cataract surgery, the eye being operated on will be gently kept open, which allows the surgeon to operate without interruption from blinking reflexes. Your face will be covered with a sheet to keep the area clean during the operation. It's usually done under a local anaesthetic. This means you'll be awake but shouldn't feel any pain. The local anaesthetic is given as eye drops, an injection, or both. When your eye is numb, your surgeon will make a tiny hole through the cornea in the front of your eye and through the clear layer at the front of the lens, also known as the lens capsule. Your surgeon will use sound waves, known as ultrasound, to break up the lens inside the lens capsule to allow the lens to be removed in small fragments. They'll remove the old, natural cloudy lens and replace it with a clear plastic lens designed to last the rest of your life. Most people recover quickly from cataract surgery, but your vision will be blurry for a few hours afterwards. You should be able to go home the same day, but do not drive yourself home. Your operating team can advise you when you can return to driving. Your vision should be back to normal before you do so. The team looking after you will talk to you about what to expect and what you are able to do after surgery. They will explain when to remove the dressing and advise on pain relief and what you should do while you recover. You'll be given eye drops to help your eye to heal and prevent infection. You'll usually need to take these eye drops for about 4 to 6 weeks. For more information, speak to your optician or visit the link to the NHS website.